My name is Brittany Larson, and I will be doing a presentation on diabetes mellitus, or DM. So what is diabetes mellitus? It is a disease, mostly unknown cause, that prevents or prohibits your body from using energy from the food you eat. And as a result, the pancreas doesn't produce enough insulin, resulting in a high blood glucose level called hypoglycemia. Brief history of diabetes. First evidence about diabetes was founded in ancient Greece, Rome, Egypt, and Persians around 1500 BC. It used to be called pissing evil, and the term diabetes mellitus is broken down from Greek and Latin roots of sweet urine around 250 BC. 1889 was the discovery of the role of the pancreas by testing removal of pancreas on dogs, pigs, and cats. In 1776 was the discovery of excess sugar in the urine, which gave it the sweet taste that people actually drank to see if it was sweet. January of 1922, the first dose of insulin was given to a 14-year-old diabetic child who lived and survived using the insulin from a pig. He lived to be 27. Later, he passed away from complications of pneumonia. And in 1966, the first pancreas transplant occurred on a type 1 diabetic. So the types: type 1 or juvenile diabetes, type 2 adult onset, and gestational or pregnancy diabetes. Before we get into the types, what does insulin do? It's produced by the pancreas in the beta cells. It's an antagonist to glucagon, which is another hormone released during episodes of hypoglycemia, and insulin is released during episodes of hyperglycemia. Insulin is the key to open fat cells to allow sugar to leave the blood and enter the cells, giving you a lower blood glucose level. And it is one of the main anabolic hormones in the body, along with testosterone and growth hormone, that are responsible for muscle and bone growth and strength. And here's a list of the different types of insulin. You have rapid, short, intermediate, and long acting. The rapid ones are the ones you usually give before a meal, and then your short or intermediate are also given before meals, but are usually needed for provider's order. And then you have your long acting ones, which is their daily insulin that they'll usually take before bedtime. So type 1 or juvenile diabetes, it has a rapid onset. Kids usually develop symptoms kind of overnight, and then it's about a week before parents kind of take them in, just because symptoms haven't resolved on their own. And type 1 only affects about 5 to 10% of the diabetic population. They're not sure what causes type 1 to occur. There are speculations of a possible autoimmune disease or a virus causing. So signs and symptoms: polyuria or excessive urination. Also, uncontrolled bedwetting is a major sign that parents will notice in their kids. Polyphagia or constant hunger or excessive hunger. Polydipsia, which is excessive thirst. Blurred vision, nausea, vomiting, fatigue, and hyperhidrosis, which is excessive sweating. Treatments: diet, lean meats, less carbs and sugars. You'll want to stay away from your white carbs, so white breads, white pasta, and eat more of your whole grains, whole grain cereal, whole grain pasta, that kind of thing. Exercise: 20 to 30 minutes of aerobic exercise 5 days a week, and always carrying a fast-acting glucose when you are exercising in times of episodes of hypoglycemia. And then those with type 1 diabetes have to self-administer insulin. Kids can be taught usually after the age of 7. And then for those kids having trouble with it, they can install an insulin pump that gets changed about once a week. Type 2 or adult onset, it is preventable. That is the biggest thing. It's usually a slower onset in patients over 40 years old that are obese, and this is 90 to 95% of the diabetic population. It's kind of slow acting in the sense that the pancreas slows down in the production of insulin and thus resulting in diabetes. Risk factors are hereditary, so if your grandpa, grandma, mom, dad, brother, sister have it, you do have an increased chance of having it. Hypertension, history of gestational diabetes, mellitus, race, and then obesity. So some non-modifiable risk factors or things you can't change are those family history, your age, your race and ethnicity, and then a history of gestational diabetes. Things you can change, you can become more active, you can lose weight, you can lower your blood pressure by losing weight, stopping smoking, and then also just controlling high blood pressure with medications, and then lowering your cholesterol. Are you at risk? So these are just some things to take into consideration. And then at the end of the presentation, there's a link you can click on that'll take you to the Diabetes American webpage, and you can take a quick 10-question quiz to see if you are at risk for diabetes. Signs and symptoms of type 2, again, that excessive urination or excessive urination at night, excessive thirst, excessive hunger, weight gain or rapid weight loss, blurred vision, if you have a wound that's not healing properly, and then an A1C of 6.5 or greater. An A1C is a blood draw that your provider will order, and this tests how your blood glucose levels were on average over the last 3 months. Treatment, prevention is the biggest treatment that there is, trying to prevent yourself from degrading anymore. Self-care, so diet, increasing your fiber, eating those lean meats. Exercise 30 to 60 minutes for 4 days a week. And then stopping smoking. Smoking causes a lot of other issues in your body, but just stop smoking. Medications, the anti-diabetic medications allow your body to be more receptive to the insulin produced or the artificial insulin you use. Anticoagulants, or more commonly known as blood thinners, to help the blood move through the body a little bit easier and not clot as much. And then statins, which affect your liver and stop it from producing a harmful cholesterol. And then the late stage of type 2 diabetes, you will use insulin since your body stops producing it. Types of medications, metformin is usually that first stage of medication they'll use. It just allows your body to be more reactive to the insulin already produced. Glipizide increases the production of insulin by the pancreas. Glimepiride is kind of a combination between metformin and glipizide. It increases the production of insulin, and then it allows your body to be more receptive to that insulin. And then, like stated earlier, insulin injections for once your body no longer produces insulin. Gestational diabetes or pregnancy, it can only occur in women during pregnancy, and it's only about 2 to 5% of pregnant women are affected, and usually resolved after delivery. It's most often in older women who are pregnant compared to a younger woman who's pregnant. And then it can lead to type 2 after delivery or later in life, so it's important to watch for those signs and symptoms of type 2 after you've given birth to baby. And then it's a blood draw with a fasting glucose after drinking an orange crush type drink. And it happens right around 24 to 28 weeks of gestation. And it's important to remember that just because you are a woman who is pregnant doesn't mean that you will definitely have gestational diabetes. Signs and symptoms are similar to the other types of diabetes, with the also increase of yeast infections and UTIs. Treatment, they usually don't use medication unless your blood glucose level isn't controlled by diet and exercise. And then they're going to monitor baby a little bit closer than they normally would in a pregnancy. Possible complications, preterm delivery or delivering before your actual due date. Um, and then baby is usually larger in moms with gestational diabetes, which results in the increased need of a C-section delivery. And then there is a small increased chance of fetal or newborn death, which can be kind of scary for a new mom. Acute complications of all diabetes are hyperglycemia or high blood glucose level, hypoglycemia, low blood glucose levels, and then diabetic ketoacidosis, which is the overproduction of ketones in the body. Whole body complications, vasoconstriction and atherosclerosis or plaque buildup, gout, which is an infection in an extremity that doesn't heal or respond to medications, hypertension or high blood pressure, neuropathy, numbness, tingling of extremities and digits, vision issues, cataracts, which is kind of like a foggy film coming over your eye, glaucoma, which is increased pressure behind the eye, blurred vision, and then in extreme cases, vision loss. Important to remember that cataracts can be reversed with the surgery. Glaucoma can only be treated with medications, but there is no cure for it. And then poor skin integrity, you're more likely to get styes or a type of infection on your upper eyelid, finger and toenail infections, so it's advised for them not to clip their own toenails, but to have it professionally done. Poor wound healing, boils, folliculitis, which is an inflammation or infection of a hair follicle, itching, dryness, and flaky skin. And then self-checking your blood glucose, it's easy and done anywhere with a monitor, usually done before meals and at bedtime, and then it's highly recommended to do it 2 hours after eating just to see where your levels are at. Poor monitoring or controlling, they'll most likely administer a continuous monitor via abdominal catheter, and this is done in older patients and children more than like middle age. A goal for a diabetic is 70 to 130. Someone who's non-diabetic, anywhere from 70 to 100. And then your provider usually wants you to keep a diary so that you can do checkups and they can see what it's been along with checking your A1C. And then urine levels can also be used to check glucose, but those you have to go into a lab to have done. There is no known cure at this time for diabetes, but in 2014, research on stem cell transplant began for insulin production, and then they do some pancreas transplants on type 1. And then just remember you can prevent type 2 and gestational diabetes. Here's that link for the diabetic assessment quiz. If you have any questions, feel free to ask in the comments. And thank you for listening.